So, Sharon, I'm excited that we're first time. We're honored to have you here and us you here at ARC. Sharon Handelman-Gotlib, co-founder and CEO of Shela. So, as mentioned, pleasure having you here. We're gonna have exciting session. We're gonna hear a little bit about startups and health tech innovation and your specific journey and how did you get to this position and maybe a bit of vision and dreams and how to make them happen. So please introduce yourself, and I think it will be interesting to know how did you get to Sheila? Like let's stop at Sheila, but what
Sure.
got you here?
So it's a long journey, and I'll start by saying thank you for hosting me and having me. I am very excited to be here and honored as part of the ARC family. It's an amazing journey so far. So I'll start by who I am, and I think that gives kind of the background. I am a mother of 4 children. 2 of them are girls, and I am a woman in a more man kind of managed world, and coming from a very strong backbone of feminism and the knowledge that and the recognition that we can do better and we should do better. And it comes again, I'll reach to that in a minute. I wanted to show that everything is possible, and that's why I'm here. And when people ask me why Sheila and why startup and why everything, because I want to make a dent in this world, to make a change, a significant one, especially in women's health, which has been underserved and underrepresented for so many years. So that's why I'm here.
So is it something that you feel like since the beginning of your career, or is it something of late years?
No, I wouldn't imagine. I mean, if you'd ask me 10 years ago where I'd be, I would never say I'd be a founder and the CEO of a startup. It's something that evolved, and I think that's the beauty of life, and that's kind of where I tell people today. I get a lot of calls and emails and WhatsApp and just to speak to potential entrepreneurs or people who want to start and kind of build a startup or a company or an idea, and I say, or a career, and I say, don't go so far ahead and just grow the capability of flexibility. I was very planned. I worked in Teva. I thought I'd be the CEO of Teva. And then Teva took the wrong turn, unfortunately. And then I understood that that's no longer my pathway. And it was a very hard and very sad moment for me, because I really believed in Teva and I loved what I did there, and I kind of saw my future there. But things evolve and shift. My last position and last project at Teva was to bring to life the idea of the innovation hub of Teva in Israel. And that was an aha moment for me, really a strong moment that I came close to understanding and learning more about the Israeli startup ecosystem, mainly in health, the digital space, which was booming. And I knew that would be my next milestone. And I moved to Maccabi to do that, and then I moved to BizDev. And somewhere in between, and again, COVID came in and really, again, groundbreaking or ground shaking, had this notion for me, or this ability to pause and say, okay, let's do something differently. And a random post that I came across about femtech and establishing the femtech ecosystem shook my life and really changed everything and got me to where I am today. Because coming from health, coming from digital space, knowing so many startups from Israel and around the world, and then I came across femtech, no idea what it is. And it blew my mind away, saying, okay, it's everything I stand for. Innovation, health, women, empowerment. Okay, I'll start reading. And then I started being very active in the Israeli ecosystem, and being very active in the Japanese, Asian, European, more global environment, being very loud, very clear, and pushing the way together with so many other amazing partners. And then I knew that my next step would be around women's health and femtech. And I met my amazing co-founders, Professor Omri Koren, Professor Yoram Luzon, Dr. Avi Tzur, coming from Shiba, Dr. Adi Eshel, and they came up to me and said to me, literally, come and join us. And
how long did it take? Did it take you to assess or think, okay, I'm going on it, and or not? Like, how was the process?
well, when they asked me to meet and the offer was there, I was really surprised. I didn't understand that was the I'd say the goals of the meeting. I thought really it took it to a different direction. But when I heard what they had, I was struck, and they said, okay, let me think it through. I went home, I spoke to my partner, I said, this is the offer that I got, and we need to assess it, because this is going to be a game changer for me, for us, for our family, for everything. And I assessed it. My gut feeling said, I'd say 5 minutes to the conversation, I'm in it. That's the honest truth. But then it was a 2-week process of analyzing and understanding more, talking to people, doing the due diligence to my co-founders more in depth. And I said to myself, you have to walk the talk. You are taking a huge risk in your career, but if you believe, you speak so much about femtech, women's health, you would be the best ambassador possible. So you can do it. That's what I said to myself.
Great. So, I think so that direction that Teva took years ago and changed actually the path of your life, and it was maybe a crisis in a way for you, losing your dream, actually it was an opportunity for you.
Yes.
And the point of change, and I think this is what startups and innovation is all about, right? Taking this opportunity and try to elevate it to something great, and actually it's inspiring to hear that that's what you did. So maybe you tell us a little bit about Shela, like what's behind the company and what's your dream with this company?
Okay. So I'll start with the dream, because I think that summarizes everything. Our dream is to be a game changer in women's health, in the women's health perception. And what we do is we build a platform for precision health medicine, precision health actually, which is a composition of 2 key factors. It's the multiomics, which are biomarkers from different technologies, capturing the genome world, microbiome, cells, etc. That's one factor, which is very precise, very personalized, very accurate, and very cutting edge from a scientific standpoint, together with clinical data, combining them and being able to provide in a market, in a category that doesn't have that, not only the prediction, possibility to predict complications, risks, diseases, etc., but also to provide the precision health pathway on the care pathway, on the medication pathway, the nutrition. So we see it as a holistic approach, saying that we've got you. Not only we understand complications, we're focusing now on maternal health. So not only if a pregnant woman comes and uses the Shela platform, we're able to identify early on the complications, we can provide exactly what she needs to meet her own personal and personal challenges, and provide that mitigation intervention plan.
So I think it's clear for me at least what's behind the company, like what's the data, what's the view, like precision medicine and maybe preventive healthcare. But maybe just for the people who don't know, in one sentence, what is Shela doing? Like, what's the product? Or...
Sure. So the product is algorithms. We have modules that have the ability to detect super early. If we're talking about pregnancy, at week 12, we can detect and predict the key risks for pregnancy. It can be gestational diabetes, preeclampsia, preterm birth, which impacts the mother and the fetus itself. And not only say to the clinical team and to the woman, listen, you're going to have an issue very shortly, but we can provide also the ability of intervening and changing that course in a very precise and personal basis. So it's based on very, very advanced algorithms capabilities, taking in your biological fingerprint, so it's personal. No woman, Anna is not related to Anamika, and Anamika has not anything to do with a woman from Israel for the sake of discussion. Each one will have her course, and for each one we'll be able to provide her personal route.
So for that to happen, you need to have some biological samples, right, of the person. So is it something that is already part of the clinical workflow, or you also need to do some, maybe I'll say it as a market education or clinical flow education?
Sure. So I think the world is going there. I mean, our clinical research and studies are based on that. So we've done that, we've covered that, we have the publications and everything to prove our thesis. So it's not in the thesis kind of bucket already. We've skipped the that grade, and we're now able to provide and really demonstrate the ability of the module to work. And I think the world is evolving around precision health, full stop, but not in women's health, not yet. And that's what we are in the forefront, really being pioneers in providing that specifically in women's health, and even more specifically for maternal health. If you look at competitions, some are focused on clinical data, or some are focused on one technology or one indication. We see it in a different way, because a woman should be approached in a holistic, pregnancy, for example. A woman or the team doesn't care about one complication. Either she has preeclampsia, but we don't know anything about preterm, and so on. But we're able to combine the very different technologies and the indication, saying, okay, this is a complete risk score. And not only that, we will have the ability to then escort a woman throughout her lifelong journey, which is amazing, because it doesn't stop after pregnancy, after you give birth, with hopefully, and that's our plan, to have healthy babies. It's an ongoing journey, and we'll be there to provide the insights, the risk and the mitigation monitoring capabilities.
Sounds great and inspiring as well. How would you define this stage of your startup?
So it's a great question with a very complex answer. I'd say we're very early on one hand, from a funding perspective, from being in the market, we're now working on that. But our clinical studies and our clinical capabilities are very advanced. We have a huge data set. We have great partnerships and networks that we're working on. Our capabilities are endless. So I'd say we are a very early stage, but I think the next step can be faster than anticipated.
How many people are involved in the Shela right now?
So we are a team of 5 co-founders, and then we have additional resources, give or take around 5 additional as well. So all in all, it's around 10, but that is something that will be growing very, very quickly and shortly.
So you were mentioning this big data, and the amount of data, and the great team and the capabilities of the team. And is ARC or Sheba, in a way, what's the role of ARC and Sheba in this, in this early stage startup life? How is it turns?
Well, ARC is, I'd say, the mothership, together with Bar Ilan. We are a joint project coming out of, one hand, the Academia Bar Ilan of Unbox Ventures, and the combination of Sheba and the ARC clinical capabilities, and the combination of the two institutes is what brings us, I think, differently and brings a different color or a different flavor to the table. And what we get from the ARC is the knowledge, the capabilities, the network. And I think for a very early stage company, it gives a lot of reassurance because we have people to consult with, ideas to brainstorm with, running clinical studies with a better advantage than others, and of course the wide network. For us, it's priceless.
It takes me back to the previous point that you've mentioned about what Shela, like the vision and the precision medicine and the ongoing, partnering with the patient and I think when you know it better than I do probably, but when you kick off a startup and you start your journey, you kind of know or wish where you want to go, but eventually some pivots are gonna come, right? And some obstacles, and I think having the great team and experienced team that is not intimidated, by the challenges that might come, and they just embrace it in a way and understand that this is the way of life and this is the way of the life of startups, will eventually will assist you in your way to succeed. In a way. So, just explaining about ARC and Bar-Ilan and the whole network that's around you. So actually, it just put the dots together in a way, and I think it's different perspective, but on the same matter. So.
And it's knowing that really the founding team are really the best out there. I mean, Professor Cohen, number one in microbiome for maternal health and infant 1,000 first days. Professor Luzon with his capabilities, amazing capabilities in creating health algorithms. Dr. Avitzur, leading women's health innovation here at Sheba. I mean, Dr. Adi Eshel, providing her vast experience in both health, in the microbiome and nutrition. We have that capability from a professional standpoint, and of course the maturity. And I'd say that, yes, they give me a lot of reassurance and the trust, and to lead this ship and say, we're with you, we've got your back. So it makes my life easier, but every day is a battle.
Yeah, sure. So
every day.
Every day is a battle, and it's a long journey. And especially in health tech, startups, it's crazy, I think. So what will be, I would say, like a best goal for Shela in 2 years to achieve?
Okay, 2 years.
The next question will be for 5 years.
Okay, so 5 years is easier for me. For 2 years, it would be...
it could be for 5 years and with a stop in the middle.
So we want to be the biggest platform, the go-to for precision health for women, adding in technologies, adding in different services, not necessarily that we'd be the one developing or innovating or creating them through partnership, which is totally cool. And that's what we aspire to do. In 2 years' time, we want to have solid, proven, and regulated products out in the market with great design partnerships in strategic geographies, mainly in the US, but not only. We want to have a good kind of sales and revenues to show the potential, and already in the midst of developing the next gen of modules. So that's in 2 years. We're gearing up towards that. And in 5 years, we want to be the go-to, as I said, for women's health.
Okay, so we'll probably will be here and then see how it rolled.
Yeah.
So what would be the power of partnerships for a company like Shela that probably needs data for some places, maybe needs some assistance with deployment, or I don't know, the challenges better than I do. So I'd like to hear more about that.
I think the power of network is providing not only the data and the deployment, but also the understanding and the ability to kind of have the design process in place to showing that we've got the right product market fit. I think that once you unreveal that or are able to crack that, this big kind of black box, is the biggest success. And I think that's what we have here with the wide network, a very globally differentiated market, geographies that we can do that. So once we have that and the trust of the network, I mean, okay, ARC is very well known and very and considered one of the leading ones, right, in the world. So okay, if it comes from ARC, it makes our lives easier, and we have that supporting direction, and I think it proves kind of the strength of what we bring to the table.
So in your past, you were head of leading innovation hubs in big organizations that used to be the design partners of startups that you've made, and now you're meeting it from the other side. Do you think are there some things that you think differently now that you see that maybe in your previous role you should have looked at them differently from the perspective of a founder of a company? Maybe it's more a question for me than for just to understand the role, but
I always knew how to identify and to use my empathy towards startups. So I don't think there is a significant change in my perspective or perception of things, but it's around the speed, the duration, and the understanding of how fast an organization need to react. But for me, coming now as a startup, I know how slow it takes sometimes, and I know to come with more patience. I mean, I don't expect to land a deal a day after we had the intro or the second conversation. I have the stamina today to know that it takes time. I take that from my previous role of seeing how it works backwards and saying, okay, I've seen startups say, okay, we've spoken to X and Y and we've got it. We've covered it. It's going to happen next month. But then the crash comes much stronger.
Yes.
And the ability to realize how it works or understanding that you need the patience makes my life easier.
Yeah, I think it's kind of matureness, right? The understanding the complexity of things in healthcare for sure, but also in life and innovation. And so I think this is probably good thing that you took from your previous roles and positions to the current one. But are there any other things in your experience, in your career that you feel that really assist you now as a founder of a startup?
Sure. Everything assists me. Absolutely. I took, I think, competencies from each one of my roles and added to my skill set and capabilities from Teva, global corporate leadership, and really working with the biggest and the best ones out there. I understood how corporate and I understand the business well, and working in the innovation under Professor Shela together with Gidi Leshetz is really seeing the ins and outs of health organizations and also understanding innovation from the kind of really foundation, algorithms, building a startup. So I picked a lot of things in that, and of course my last role as biz dev and understanding and co-creating, and they also gave me the opportunity to really open new startups. I mean, I created my own ones, had my sandbox, and that kind of really prepared me for where I am today. So from a tip perspective is, even if it's sometimes hard or even if you don't understand, it's never first not regret what you did. Don't block yourself and try and learn and enjoy as you go.
I think it's a great tip, right? The greatest you can get. And you can give and I can get it. It was amazing. I'm curious because you're a really Israeli founded a startup, both from university and a medical center, and all the team I think right now are Israelis, right?
Correct.
Is Israel your target market? No.
No.
So what is Israel for you in a matter of the stage? Like what would you like to achieve here, and what is just like the sandbox, or how do you see it?
It's a good sandbox, that's one, but not necessarily. I think what we gain from Israel is the great resources and the strong people that are here. the technology, the grit that we get here, the ability to build that foundation. And of course, we don't see ourselves, Shela, as to be only Israeli. I mean, our plans are to expand. But that's for us to be here as the kind of very significant cornerstone for us that will take us then and the capability to expand. So it's the power of what we bring to health and to innovation.
Do you think that the birth ratio per person in Israel that we know is one of the highest or probably the highest in the world is could be a key factor for the success or for the enhance of Shela? Like maybe it's something that I don't know was part of going to that direction, because Femtech, I get why did you go to that direction, and as a mother and as a woman for sure, but what about focusing on pregnancy?
I think focusing in Israel, focusing on pregnancy, I mean women who are pregnant and carrying a child get royal treatment, I'd say, sometimes more than other countries. I mean, it's all about, we're all as a culture and as a society focusing around that. So I think it's more to other populations, actually, the ones who are more underserved and unmet. It could be developed and non-developed countries as well that we should consider. And as well, the declining numbers. So Israel we have that, we're gaining technology, but in countries that the rates, the birth rates are declining, and you see the government trying to push forward and encouraging birth rates, I think our capabilities will enhance that kind of call for action for families, for people, because the age of women going into pregnancy is higher, and that entails more severe complications. And by providing kind of the assurance of we've got your back, I think that will help. So it's a non-Israeli kind of a prism that we're looking through.
Yeah, actually, I think it's a great perspective, right? Like taking something which is, to understand from a play that has a great healthcare system or public healthcare system that allows people great access for treatments, and how you can maybe, I wouldn't say duplicate it, but take this idea and make it more democratized in a way that you can approach different markets and give them the access to the technology. It's amazing in a way. I think this is kind of what ARC is about. About in our vision to get global, and this is the kind of technology that can really assist us in achieving these goals. You gave us earlier a great tip, and I'd like to ask about a great tip that someone gave to you. I know that in our ecosystem people always love to give tips. Most of them, I don't know if most of them, many of them could be not good, but maybe one that you've used, one that you took to Shela or to your position as CEO.
Yeah. So the best tip that I got some very good ones, but is trust your gut feeling and try to kind of eliminate the negative background sounds that may come. I mean, if you believe in something, go with that, and what's best for Shela, and try to work with that. So that's kind of my best tip that I got.
Great. Okay, so I really like to thank you.
Thank
for
you.
Coming, and it was inspiring and great. And how we're gonna have next session in 2 years or 5 years, and we can get to remember in this conversation and to see what went by the plan, what plans has been changed, and what's next for Shela, ARC.
That would be amazing. I look forward to that. Let's mark it on the calendar already.
I have the date.
Great.
I'm sending an invite. Thank you.
Great. Thank you so much.